Marshall has been the host for about 24 hours to some very special guests from the National Institute of Health's National Institute of Neurological Disorders and Stroke. This institute has been at the forefront of our country's efforts in brain research since the 1950s, and its studies range from the structure and function of single neurons to the causes, prevention, diagnosis, and treatment of many neurological disorders, and most recently, the translational research that is helping to bridge the gap. While they've been here, they've been able to see some of the treatments that we're doing here at Marshall for pain and also for opioid abuse. They've been to Lily's place, they've toured our School of Medicine, they've looked at Cabell Huntington's newborn intensive care unit, neonatal therapeutic unit, and they've seen firsthand some of the approaches that we're using to treat children and other patients who are afflicted with opioid addiction. They just participated in a roundtable over lunch, and we had a great discussion about what we have here in Huntington and what we're doing and how we're approaching pain management in the opioid epidemic. They've shared with us some of the work that they've done and the priorities for funding of the neuroscience and pain management research in their institute. And I can tell you that we've told various groups during this visit that we're very proud of the work that we're doing here at Marshall and in Huntington. And I'm hopeful that NIH will look favorably upon institutions like Marshall, of our size, other institutions like ours, where we are in the trenches doing the innovative work to help solve these problems. I feel that we have forged some very good relationships with our friends from NIH, and I want to thank you for that. It's now my pleasure to acknowledge and introduce Congressman Evan Jenkins. He is a great friend of Marshall University. He facilitated this visit, and for that we're very grateful. He's always been there for Marshall when we need him. Evan, as always, we thank you for your support.
Thank you, President Gilbert, Dean Shapiro, and the med students. This is terrific. Thank you so much. It's been a great day. I have the honor of representing the 3rd Congressional District. That's 18 counties, starts up in Mason County, down here to Cabell, all the way to Pocahontas County. And I get a chance to serve on the House Appropriations Committee. And a lot of people think members of Congress, it's really about going to Washington and casting votes, yes or no on legislation. I view my role as, yes, it's that, but it's also about making connections. And I had the opportunity as a member of the Heroin Task Force in Congress to meet with the director here just several months ago. And I asked Dr. Koroshetz, would he mind bringing his team? Because, you know, I'm from Huntington. This is my community. This is my state. And we know we are on the front lines, but we're also doing some incredibly powerful, effective things to battle the disease of addiction. We're saving lives. We're addressing challenges in people's lives. So he kindly brought his A-team. Here is a gentleman who has oversight of a budget of about $1.7 billion in funding. So we've got opportunities. I know the great research. I know the great work that is being done right here at Marshall University, Cabell Huntington Hospital, in our community. So this is about making a connection. This is about bringing together the funding resources, but also right here at the grassroots. Now, the doctor asked me, he says, now when was this hospital founded? Am I doing something wrong, Linda? When was this hospital founded? I said, I don't know when it was founded originally, but I was born here 57 years ago, so I know it's been here at least since then. Bottom line, Dr. Koroshetz, thank you for coming. Thank you for bringing your team. It has been a great, as Dr. Gilbert says, 12 to 24 hours of eye-opening for all of us, but most importantly to our med students and to all the community leaders, thank you all for what you do. Do I turn it over to, great, well, without further ado, the man of the hour, the director of the National Institute for Neurological Disorders and Stroke, Dr. Koroshetz.
As the Congressman said, we're here from the National Institutes of Health, and we at the National Institutes of Health really are the taxpayers' investment in science of health to look to the future and provide solutions to health problems. And our institute, we have lots of problems, and we're always looking for solutions to each of them. But the visit here is particularly focused on this epidemic that is hitting the United States, which is the opioid epidemic of addiction and overdose deaths. And NIH has been, over the last 6 months, thinking very deeply about how we can make an impact to attenuate this real tough problem. And the visit here, I think, was really important to us because it gave us a chance to get out of the Beltway, which is always a good thing, and to come and really talk to folks who are in the trenches. It's very clear to me a couple of things. One is that in this community, the crisis has brought out some real courage in many people who have really looked at a problem and not waited for the government to come in and fix it, but to try to, do what they can themselves. And that is really important, because those are the people who are going to really shake things up. And those are the people that certainly us and NIH are looking to give us the messages and the secrets to how we might be most effective with the funds as they go out to inform practitioners on how best to attenuate this problem. And I think for the medical students here today, I'm just brought back to when I was in training, and at that time, people were dying of a very strange disease, and they were gay men, and they were dying. We didn't know what they were dying from, and it was a terrible epidemic, killed thousands and hundreds of thousands of people. And at that time, there was really nobody really taking ownership and to solve the problem. But what happened in that time, both on the outside of medicine and particularly for the medical students, people took it upon themselves to make a career out of trying to solve that problem. And I think there's opportunities now for the people, particularly in this room, who have seen it, to take ownership and make a difference like no one else can. And so for the medical students here, think big. Think, how can you make the greatest impact on health that fits in with your aspirational goals? But clearly, this is a problem that you've seen some unique features of and could give you a real head start in moving this forward. I also want to say the Congressman has just been a tremendous leader in this effort. I'm incredibly impressed when I meet the legislators, but Representative Jenkins is something really special. He's really taken this ownership, and you can really feel the sense of community that he talks about, and when we come in here and visit, we can actually see. So thanks so much for getting us down here. I think we learned a tremendous amount, and to the President Gilbert and Dean, thanks so much. And as we mentioned, at NIH, there have been plans to try to put things together that research can make a difference, and we're hoping that those will come to fruition in a short time frame. And then we're looking, to tell you the truth, we're worried that we're not going to have the workforce to be able to manage this big effort. So we're out here looking for worker bees too, and you all look very good. I think you'll all be super worker bees and leaders to drive this effort. And so I wish we didn't have this crisis, but we do. And I think the people in this community have rose up, and you're in a special place right now. So thanks very much. It was a pleasure coming.
Well, I'd like to thank everyone for coming. This has been a great visit. We face a terrible problem, but candidly, I think we're up to the task. We've got great leadership with President Gilbert, who recognized immediately on his arrival to Huntington that this is something that we really needed to work together with our community partners to address. And Representative Jenkins, what a statesman. I just don't know what to say. I'm so touched that you were able to put this together. Thank you.